cold weather, although I've been advised it's slightly better today than it has been, so it's a beautiful day here in Canberra. So my name is Sharon McGowan and I'm the CEO at the Stroke Foundation. So we really appreciate you making the time to be with us. I'd like to begin by acknowledging the traditional custodians of the land on which we are meeting here today. I pay my respects to elders past, present and those emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the land and waters of the Capital Territory. And I would like to reflect that it's just been Reconciliation Week, and the theme around Reconciliation Week around being brave and making change really resonates with the Stroke Foundation. I think this is what all we want, is to be brave for the future and to believe that we can change the state of stroke in this country and really shift the dial. And that's what we want to talk to you about today. So I'm delighted to welcome the Honourable Minister Stephen Smith. It's lovely to have you here again today and to meet with us. We're here to talk to you about our work at the Stroke Foundation and to thank you for the investment that you've made in what has been an incredibly productive and successful partnership over the last few years. I also want to introduce the wonderful Gus Sabatino, who will be sharing his own personal lived experience, having experienced 2 strokes. He will tell you all about that. And he's not a shy wallflower at all, as our Gus. I also want to welcome Joe Lafferty and Julie Tressadier, who are with us here today. These people also have a lived experience of stroke, so please take an opportunity to meet and greet with them. Stroke is a medical emergency. It strikes and people and families don't get any time to prepare. Often there's no warning until a stroke actually happens. And when a stroke happens in your brain cells are dying. So the faster you get action by actually getting treatment in hospital, the better that your recovery will be. But it can be a very challenging journey of recovery. And we say stroke doesn't happen to one person. It happens to an entire family and to their community and their support network. So thank you for being with us. It is generous for you to give your time to us, and we really appreciate it, and I'm sure you will get a lot from listening to Gus particularly. So without further ado, I'd like to invite Minister Stephen Smith to say a few words. Thank you.
Thank you very much. This land is Ngunnawal land, and I pay respects to elders past, present and emerging, and again acknowledge the Reconciliation Week just gone and the importance of making change for Aboriginal and Torres Strait Islander people. But it's great to be here today. Sharon, thank you so much. And of course, our partnership with the Stroke Foundation is one of our really important non-government partnerships for the ACT government. Because of all the chronic health conditions in the ACT, stroke has one of the largest impacts on our community. And stroke and heart-related conditions account for some of the highest rates of potentially preventable hospitalisations and some of the most significant burden of disease in our community. So, Stroke Foundation, as a national charity that partners with community to prevent, treat and beat stroke, is one of our key partners as ACT government as well. And this work really includes raising awareness of the risk factors and signs of stroke and promoting healthy lifestyles. And I don't know how many of my MLA colleagues have had this experience as well, but after my first meeting with the Stroke Foundation, I was so freaked out I went to my doctor and discovered that I have high blood pressure, and now I'm being treated for it, so yay! It is one of the risks of being a health minister or shadow minister or a spokesperson that you do get quite paranoid about some of the things that could be wrong with you. But really, the ACT government is, continuing to partner, but also to invest. Canberra Hospital, of course, is one of 11 comprehensive stroke centres in Australia. Its endovascular clot retrieval was commenced as a 24-hour service at Canberra Hospital in December 2019, and around 65 cases are treated annually. And prior to that establishment of that service, people would have had to go to Sydney for that treatment. The stroke service at Calvary was established in 2014 and is currently funded for 4 stroke unit beds as well, and it provides acute stroke and rapid transient ischemic attack clinic services. So, and of course, all of this, our hospitals are teaching hospitals, so that contributes to undergraduate and postgraduate education and to research activities as well. Canberra Hospital offers a stroke clinic as well for those who've been discharged or following a TIA or stroke. And the government has funded the Stroke Foundation since 2018 to run Stroke Connect, which is a telephone follow-up service providing post-discharge care for local stroke patients from both Calvary and Canberra hospitals. So most patients who are admitted with stroke to Calvary and Canberra Hospital are referred to the Stroke Connect program, and it's now a very well embedded referral service with more than 70% of referrals successfully receiving that follow-up service. And a translation service available for those who require a call in a language other than English. So during the 2020 election, we recognised the advocacy of the Stroke Foundation and committed to continuing to deliver this service and to expand our partnership with the Stroke Foundation. And I was really pleased to deliver on this commitment through the 2021-22 budget with ongoing funding, and also providing funding for the Stroke Foundation to deliver the Australian Stroke Clinical Registry and the Australian Stroke Data Tool, again used by both Calvary and Canberra hospitals, and of course, in addition to that, funding the FAST education program, which is scheduled to begin in the next few months. And so I'm sure everyone in this room knows, FAST, face dropped, arms can't be raised, speech slurred or confused, time is critical, call 000, and it's always incredible to hear about the stories of the impact that training has had on people and their quick access to treatment and their good recovery as a result of that. So the program will provide education to GPs, community health centre staff and community care team members to help them recognise these most common signs of stroke, manage stroke risk factors and educate patients on the risk of stroke. So again, really appreciate the partnership that we have with the Stroke Foundation. Thank you all for being here today to hear a bit more about it. And I'll shut up and let people who are more interested than me get on with speaking. Thank you very much.
I love it. Fantastic.
Thank you, Minister. Last year, as the COVID pandemic hit us all and our whole world changed, stroke didn't go away. We actually were out there in the community still talking about stroke and the impact that it had. But we also celebrated a bit of a big milestone for us as an organisation, 25 years of being dedicated to fighting stroke in this country. And during that time, we've come a long way as an organisation. So significantly, we have invested in FAST awareness, so that is raising the knowledge of the signs of stroke amongst our community. So it's fantastic to be able to be partnering with the ACT government to make sure that Canberrans and everybody working and living in the ACT knows the FAST message. It's a critical first step to us enabling people who are affected by stroke to get their best recovery possible. We call stroke a chain of survival, and that chain starts with the person standing next to you. Would that person standing next to you recognise that you were having a stroke? Because if that happens, you start that initiation call. So the call to the emergency services, the quick arrival at hospital, the fast access to treatment gives you the best chance of a full recovery. So that first step is making sure that people in the community actually know the fast signs of stroke. And it's the person standing next to you in your workplace, in your home place, in your covenant. So it's really important message to get out. So we've also supported vital research to develop and implement some of the new stroke treatments like the endovascular clot retrieval, which is a fantastic treatment. This is one of those game-changing treatments that has enabled people that suffered the most significant strokes, such as large vessel occlusion, where people often end up with full-time nursing care if they survive. And the research was driven by researchers in Australia. It has led to a global change the way this stroke has been treated. Endovascular clot retrieval is now available 24/7 in Canberra. So it's a really, really important investment, saving and improving lives. We've also initiated clinical guidelines in a living model. So most people would think about, how do you find out how to treat a stroke? It used to be that guidelines were updated about every 5 to 7 years. Now research happens much quicker than that. So we know we need to be able to respond to research in real time. That endovascular clot retrieval is a great example. When the research first came out, the time window to use that particular treatment was 6 hours. In Australia, that's a bit challenging, getting people in from regional areas all across the country into specialist centres within 6 hours. The next set of research expanded that time window out to 24. If we had guidelines that were static, When they were released in 2017, we wouldn't have been able to tell doctors, actually the research now says you can treat people out to 24 hours. For a country like Australia to be able to say, we can update the guidelines within a 6-month time frame, get them all consulted on and get them into hospitals, that enables people to get access to this treatment. We've initiated that in the Stroke Foundation, and it is now becoming the model and the way to do clinical guidelines. So working with governments like the ACT, it's a good news story we have to share with you. You lead the rest of the country in terms of state government support for stroke, recognising that it's such an important issue for Canberrians, recognising that we can do more to prevent this disease, we can do more to make sure that people get access to early treatment. The treatments are available. We have a fantastic health system in this country. We need to get more people to hospital fast, and we need to make sure that everybody that's discharged is given access to the support services they need to make their best recovery possible, and to get back to work if that's what they want to do, or get back to study, get back to living a life after a stroke. So I'm actually going to ask Gus to come along and share his story. Gus has had 2 strokes. He's an amazing advocate for us. Really, really strong message. Gus has actually been known to run along as part of a fundraiser for the Stroke Foundation, filming himself while running uphill to talk about stroke. So I'm going to hand you to
Okay, how the heck do I give justice to that, Sharon?
Easy.
Easy. Thank you so much. Thank you for the introduction. Thank you for everyone for being here today. I'm actually honoured. It's a very emotional feeling to be able to talk to you guys. I also want to acknowledge the Ngunnawal people and the traditional custodians of this land. Want to pay their respects. I am Canberran as much as I am a Sydney-sider. I have residence here and in Sydney, and this is also home. When it gets too cold, I go back to Sydney. But we won't go there. My story starts 8 years and 63 days ago. And to be very honest, if it wasn't for the care that I received when my story started, I probably wouldn't be here today, the person that I am talking to you. You know, at the time, I didn't consider myself anything special. I didn't smoke, I didn't drink, I didn't take drugs. You know, I exercised every day, sometimes twice a day. And yet, I had a stroke. I was a very boring person for all context of society, right? Didn't do anything fun. And yet, I still had a stroke. It started at 9:20 in the morning on a Saturday. The 5th of April, as I was parking the car into the driveway. All of a sudden, my arm started to tingle, and from there, within a period of 1 minute, my arm became unusable, and it was pretty much a dead limb. So we're talking a 1 minute time frame. And I managed to get out of the car using my left arm, tried to get in through the front door. By the time I made it into the house, my partner couldn't understand what I was saying. I lost all feeling to the right. I looked in the mirror and I saw this guy that looked like Jello. A candle that has just been burnt, pretty much flopped, right? It was stressful to say the least. I knew something was not right. Obviously, I knew something was not right. At the time that I actually had the numbness in my arm, I actually said, Gus, should be right, mate, get over it, it's just a numb. You know, you just pinched a nerve. It turned out to be something completely different. Anyway, I managed to get my partner, who recognized the fast stroke recognition steps, and she immediately called the ambulance. I was lucky enough as well that there was an ambulance within 10 minutes from where I was living at the time. I went into hospital, and I was also lucky that the emergency department and the triaging actually recognized what was going on, and they fast-tracked me through to actually be able to get an MRI as quickly as they possibly could. By then, it was 2 hours. 2 hours had passed from the moment that I actually identified that something was wrong to the moment where I was walking into an MRI. Anyone that knows an MRI, they take about 40 minutes, right? So all of a sudden, my 4 hours were clicking along because reality says that within the first 4 hours, you have the best chance of actually removing or reducing that stroke that's taking the oxygen to your brain. So life was ticking, time was ticking. I got the MRI done, they identified it was a stroke, I got the thrombolysis done, and then it was recovered. I'll fast track a couple of months, a lot of physiotherapy, a lot of mental hygiene support, right? Because when you go through that feeling, it is very mentally disturbing. You are no longer yourself. A lot of speech therapy. I lost my ability to speak. Right? I was slurring. Even when I came out, even when my clot was dissolved and the brain started to resync again, and I could actually feel my brain trying to get all of its energy, resyncing itself, trying to go back to where it was. Oh no, I can't go in there. I need to go somewhere else. And it was really an intense feeling. It's amazing. And then going through therapy of endless mind games in learning how to re-articulate that brain sequencing of going back into your database, grabbing words, putting them together, trying to make sense out of them and getting them out of your mouth. Horrible experience, I can tell you. It's horrible. You try to make a sentence and all of a sudden the words actually don't come out the way they want, The ending of the sentence starts first and the part of the first sentence goes last. And you say, that's not what I wanted to say. My brain says, no, that's not it, but why is my mouth saying something different? Anyway, all of that happened, right? I thought through the whole recovery process, will I actually be better again? What's going to happen? Is this going to be Gus, right? And when I say there was a lot of mental hygiene to be done, it's that part where you need to accept that all of a sudden you've become a very different person. You will never be the same person that you were before because you have dead brain cells in your head. Now that brain is no longer functioning the way it is. And all of a sudden you have to learn. You learn how to do things differently. You learn how to slow down your speech so you give yourself time to sequence the sentence. You learn how to bring the words into the right place. So it's very mentally, as a victim or as a patient or as an individual. I don't like to call myself a victim because I don't like to victimize myself. It's mentally disturbing as an individual. No matter how much someone tells me, Sharon and anyone else, oh gosh, you look okay, you're good, look at you, you're talking well, Nah, don't tell me that I am okay. Every day I get up and I think, what happened overnight? I go to the mirror and I make sure that my face is not drooping. Every morning I get up and the first thing I do is I say something. Am I slurring? 2014, we are in 2022 and it still happens. Right? I actually clench my hand to make sure that nothing is wrong. So it stays with you. As a victim, it stays with you. And it will stay with you forever. And I put it in the same sequence of events as when you lose a loved one. No matter how good you think you are, it stays with you. And this is the same. You are losing a part of yourself. And it's heartbreaking. Anyway, let's make it more fun. So I mentioned what happened then, all right? The thoughts are always there, what do I do? I want to move the clock forward a little bit and take you back to 2019. I have a brother in South America. I have a mum in South America. They live over there, I live here. I told my brother what happened in 2014 about the stroke. I didn't tell my mum. There was a reason. Elderly. Could she do anything to help me? Physically, to recover my stroke? No. Would she wanted to come and be here with me to go through that process? Yes. God, yes. But she would only just be a carer. And I realised I actually made it, as a stubborn guy that I am, my own journey of recovery. I needed to go through that. I needed to know it. So I didn't tell her. Until December 26, 2019, I was on a plane to Uruguay to spend New Year's Eve with my mum. 1 hour after landing, I sat down and we were having a coffee, and all of a sudden I felt that my vision was going blurred. And I took it down as the macho guy that I am. Gus, jet lag. You've just done 24 hours. You've been in Chile for the last 6. You don't love Chile. The football players that we are always in competition with. I went and had a bit of a rest. So, slept, woke up the next morning. My mother comes through and gives me a cup of coffee, and I did not see the cup of coffee until it was almost here. And I said to my brother, was sitting there, come here, we need to talk. I knew something was wrong. But what happened then is that none of the things that we talk about in fast were actually visible. My stroke was an invisible stroke. I didn't know it, I didn't feel it, and yet I have the experience. I went to the optometrist, or whatever they're called, the specialist, had an MRI had a depth of field scan, and he goes, Gus, 2 things could have happened to you. You either had a partial heart stroke or heart failure, or you've had a stroke. And I said, what? You've had a stroke. I'm in Uruguay. My mum doesn't know I had 1. Now I need to tell her I had 2. What the hell? Anyway, went to the hospital, Australian, in Uruguay, went to the British hospital, get the best care in the world. MRI comes back, yep, you've had a stroke. So now my brother said, we need to tell mum. So I did. I told my mother that in 2014 I had a stroke. She cried. Why didn't you tell me? I could have been there, I could have helped. Told her the reasons why. Mum, just come back from the hospital, I've had another stroke. My mum cried, my brother cried, my brother's partner cried, I cried, we all cried. Bloody hell, it was Niagara Falls in that room. Like, half an hour, it was just all over the place. But the reality is that no matter how much you think you are okay, you're never okay, and you don't know when it's going to happen. I came back to Australia, ended up 3 days in St. George Hospital, because I got off the plane. Before I came to Canberra, I said, I'm going to go to hospital and get rechecked. They kept me in there. They did some tests. I ended up finding out that what was causing my blood clots was a little tear in the heart, which was fixed by putting in a PFO, which is a little umbrella kind of scenario. If you imagine, you have 2 chambers in the heart with a little wall. Basically, that wall was had a tear. We're all born with it. Mine didn't seal, and they just squashed it with a little PFO thing. And now I'm okay, supposedly. I don't know. Can someone guarantee it? I speak to my cardiologist. He said, I can't guarantee you're not going to have another stroke. So I need to take care of myself. I exercise. I do all the things that I did before when I was really, really boring. I do them even more boring today. But, I guess where I'm going with all of this is that in my case, I think I am here being Gus and having Sharon say all those things about me, running and filming and doing all these things, thanks to the immediate care that I got. If it wasn't for the immediate care, no stroke victim can ever be the same. And being the same of what they were, they're not going to be anyway. So getting that care up front is fundamentally important. And I'll take it to the extent that we need to improve the ambulance service and get ambulance on site. We definitely need to do the awareness. It's fundamental, right? Awareness becomes the initial phase of knowing what's going on. Then you need to get the ambulance, or someone actually drives you to hospital. Then you need to get the hospital to be able to respond effectively. And we've had 2 years of hospitals that have been under pressure. How do you get a hospital that is under pressure to actually accept fast-tracking a stroke patient so his life is not disturbed for the rest of his life. Once you're there, you need to get your MRI. And then you need to organise to have your neurologist to come in, because sometimes, depending on the day or the night, they're not inside. That's a delay. Call the neurologist to come and actually do the diagnosis. Make sure you end up in a hospital that has the facility to be able to do thrombolysis. There are a lot of events in the chains block cycle, if we want to talk crypto, that actually makes this successful. Now, the Stroke Alliance and the Stroke Foundation and the health system are working through a whole lot of things, right? We're trying to get ambulances with mini MRI scanners in them. They're in Melbourne. We're trying to get aeroplanes to be able to access the remote areas with an MRI on board. We're doing the telehealth and a whole bunch of other things, but really focusing on getting that immediate care for a stroke patient is really fundamental to be able to be anywhere like me. And every story is different. I'm one of the lucky ones. You know, I've had 6 years of very lucky, stubborn South American mentality that's helped me through the process. You know, within 5 days of coming out of the hospital in 2014, I was actually walking with a stick, but I was walking. By August 2014, I ran the city to surf in 89 minutes.
Hey.
I was stubborn as anything, right? But not everyone is as lucky. Because if the delayed response to actually manage that stroke event takes too long, I would not be able to walk, or talk, or move my arm, like a lot of stroke victims are. So, if you can, more focus, please, especially in the emergency ward, especially to those triage nurses so they can understand the patient that they're confronted with. Because if I turn up into a triage nurse in the emergency ward and I don't show a lot of the normal physical events of stroke, and because I know, I tell them I have a stroke, I might not be put through it. You have to validate it. And then you look around and you say, well, I've got someone with a cardiac, I've got someone over there with a broken arm. It takes part. 560,000 stroke victims today living in Australia. Right? It's a lot. 100 a day across Australia have a stroke. It's a big number. It's a big number. How do we help it? You guys to make the difference. Because we're here to help, but you can make a difference. Anyway, talk too much.
So much. Thank you so much.
It was 5 minutes. Sharon said 5 minutes. I never listened to Sharon.
Just made it to 4.
You know, my stroke says that timeline was actually hard. So, thank you for listening. Thank you for letting me tell you what's happened to me. And yeah, appreciate it. Thank you.
Thank you so much. Gus has actually told you a lot about, you know, what it looks like when you actually have access to a system that works. And that's why it is so important that we have these code stroke protocols in hospitals, that we have good education. So we're absolutely thrilled that the government has chosen to partner with us and extended the current contract to actually deliver fast education. So we will be delivering it, particularly with GPs, with primary healthcare, community workers, and making sure that the people that can respond fast actually know the fast message in Canberra and in ACT. We have some amazing hospital services here. We want to make sure that people get to hospital in time to use them. And then the follow-up service that you've also been partnering with us on. Honestly, ACT leads the rest of the country in the investment you've made in improving the opportunity for people to make a good recovery. We know that when people leave hospital, it often feels like they're falling into a black hole. And that follow-up service is that critical lifeline. And I can't tell you how important that was during COVID, when people were being discharged early from hospital, when inpatient rehabilitation was being closed down or affected by restrictions. You know, the follow-up service here is actually part of a model that we have now pitched to the federal government to say, we need to be doing this kind of service that's been done in ACT across the country. So we're talking about a navigator program, and it's built off the evidence that we have from the program that's here in ACT. So I really want to thank the ACT government. Our vision is ambitious. We want a world free from disability and suffering caused by stroke. We know that many strokes can be prevented, and I'm delighted that your blood pressure is now under control. My own blood pressure was found by our very own campaign, so it can happen to anyone. You know, knowing that your blood pressure is, getting it checked regularly and adopting those healthy lifestyles can mean the difference between life and a life full of disability. So we can do more in prevention. We're doing amazing things with fast education. We're doing amazing things with the ACT government to follow up and track what's happening to stroke here. So you're doing great things. Please talk to your colleagues around the country. Get them to follow your example. We would love it. And just thank you for making the time to be with us today. You've been an amazing partner, and we look forward to continue to partnering with you. Thank you.
You know, Joe had one of the earliest stroke clot
Yeah.
retrievals in Canberra in
there you
2018.
Oh,
Yeah,
You know what, the
before
guy-
the
yeah.
program was actually implemented.
So part of the research.
Yeah, I was
Yeah.
just lucky that they were all
Joe had a
around
stroke on a
and they
Saturday
were
morning.
obviously aware of what they were
Wow.
doing.
I recognised it, we got him in an ambulance. And even though the stroke nurse at the hospital went, oh, that guy who does them, there's only one